Um,
I think I looked
for
into
us,
that, and it said that you couldn't take boards if your school doesn't release all your information.
that's true. I mean, that's fair. Uh, but who's who say that they will or will not? Once you submit the paperwork, they receive it, send them an email and say, "Hey, I would like to take my boards early." They may challenge you. They may not. They may
Hmm.
say, "Okay," you know. So yeah, like I mentioned this to a few people. I took mine. It was 9 months before graduation,
Oh my God.
the doctor's degree. So, but I
Were
had
you
been
able to
preparing
work?
for wow. Say it again.
Were you able to work?
My work was going to school. I got paid to go to school.
Hmm.
I know it's a little nice, right?
Yeah.
But yeah. So for 3 years, I my job was to get my job was to go to school. I got full salary and everything to go to school. So uh, yeah, it was nice. I the nicest ever. Can't
Yeah.
complain. Yeah, yeah, can't complain at all, at all, at all, at all.
Wow.
Yes. Albany, how can I help you there?
How do you join the Kahoot? Do you have to use a different device that you're on?
Well, I believe you are on your computer, correct?
No, I'm on my phone. Do you? So you
Oh,
have.
yeah. So you use your phone to play, meaning to submit the answers, and you
Okay.
use the Google Meet to join us on a computer.
Okay. Okay. Thank you.
Yeah, absolutely. So with your phone, you take a picture of the QR code, and then you create a nickname, and then put in the PIN number, and then you should be in. All right, guys. So we're just giving 5 more minutes for those that are new and trying to join in. Meanwhile, use this time to ask any questions. So we went over a lot of concepts on module one, right? It
I
was
have a
long, yes, and painful, but we got through it. So what is your question there?
so my question is, yesterday we went over NMS and serotonin syndrome, and what is
Yes.
the best way, like in practice, to differentiate um, hyperreflexia from muscle rigidity? I feel like hyperreflexia
Okay.
might also appear like muscle
Hyperreflexive
rigidity.
versus okay. So hyperreflexia, think of it as being super flexed, especially on reflex, right? Rigidity, you will know, it's like board like. It's like someone is doing this and you're trying to move the patient's arm and they can't, and you can't. Oh, I mean, you can, but it's very rigid. It's in practice is very amazing, and there will not be a problem.
And hypertonic,
But hyper,
hypertonic.
all right, yeah. So can someone a good example hypotonic said hypo or hyper?
Hey guys, don't forget to mute that live mic.
Yeah. So
I have a question. Do we
hold
need
hold
to
on hold on
download
one second.
Kahoot?
1 second. Let me finish just answering this question here, and then well, since you're downloading, what is your question about the downloads?
Do we need to download Kahoot or we're gonna play from what I'm seeing on the screen here, the purple with the names?
So if you're new on Kahoot, you are you can you don't need to download it. All you have to do is use your phone to get the QR code, and then you add the PIN number.
Yeah, I'm seeing I'm I see. So use the phone to get the QR at the pin number.
Yes, and then you add your Kahoot name, your nickname.
Okay. Let me do that now. Thanks.
Okay. All right. So there was a question there about hypotonic, I believe, right?
No, hyper.
Hyper. Okay. So one quick second. Instead of me answering this, I can skip my screen. One sec. Okay, here you go. Can anybody
Hey,
give
Amy,
a
your mic is on.
please mute yourself unless if you're speaking? What does hypertonic means? Anyone can give it a shot to this? That again?
Pamela, you have a live mic.
So
Pamela.
all right. So when do we say hypertonicity? What does it mean, right? So basically, is a manifestation that that's often really bad, right? So if you ever see somebody with hypertonicity, it's almost like you should be not almost you should be very concerned, right? Because the neurological issues, sequelae, right? So it's not natural for someone to be hypertonic. Now you have to wonder uh what is happening. Oftentimes when you see somebody that's hypertonic, there is a electrolyte imbalance, usually salt, sodium, right? And maybe even some hyperglycemia. Okay, so now we're talking about very different than psychiatry. Okay, so so it's I don't think I quite understand your question. Are you talking about your muscle rigidity, or are you talking about your hypertonicity?
I guess I'm trying because I've been seeing like these terms, all over when I'm doing my studies. And I guess I'm trying to like
Yes.
really understand the difference. Okay, what is hyperreflexia? What is
Okay.
muscle rigidity? What is hypertonicity? Like being hypertonic almost sounds like being rigid.
Yes. So if it's hypertonic, I mean, if it's the muscle rigidity, yes. If it's hypertonicity in relation to the blood, then we're talking about sodium and glucose specifically. And usually that means a neurological sequelae that's been something has happened. Not good. Okay. Now, as far as NMS, the rigidity in NMS, have you ever seen an abdomen that's full of blood and that's kind of like they call it board
It's
like?
hard.
Yeah. So think of that, but being in your arms, being constricted, right? So that would what NMS would most look like. Now, if you look at the serotonin syndrome, think of someone that's very, very flexible and well, not flexible. I would say it's more of a reflex where you use your hammer and then they would be like all over the place, right? So that's how I think would be the easiest way to differentiate them. Okay. But let's be very, very clear on something. When you look at an NMS, you have to ask yourself what caused it. And then this has to be a psychiatric has to be a antipsychotic medication. So if it was not a antipsychotic medication, then most likely it's not NMS. And the same goes for serotonin syndrome. Has to be a serotonergic medication. Otherwise, it's not serotonin syndrome. Start looking. And the other point I wanted to make is NMS is very, very rare.
What is
Okay.
NMS? Can you say the whole word?
Yes. Neuroleptic malignant syndrome.
Okay.
So yeah, it's a condition that usually, I mean, not usually, could happen when someone switch medication, adding medication, increase medication, antipsychotics medication, okay? Antipsychotic medication. So for you, Michaela, I think if you could, if you wanted to take the psychopharmacology course now, it would be huge for you because you can do it while you're in school and get all this knowledge that you may or may not get in school. I I mean, I know after school it's kind of difficult, you're in a real life, but while you're in school, if you have the time, I'll talk to you more about it in a little bit. Okay, guys,
Okay.
we're about to get started. I don't want to take very, very long. Uh, Hopefully everyone is in by now. Remember, if you're new to Kahoot, how do you play? Well, you look at your screen for the answer, I mean, for the question, and you press on your phone that you're playing to answer. You get points if you are correct, and you get more points if you are fast. So let's say three people got the answer correct. The first person that answer gets a little bit more points. With that being said, good luck, everyone.
So Doc, do I have
Oh,
to download Kahoot on the phone as well? I got my name in. I
no.
just
So you're
saw it.
good. If you got your
I
name,
saw
you're
it.
good.
I saw it on the iPad that I have
Okay.
you on. But what about my phone?
No. So can you answer this question on your iPad?
Let me see. A 49-year-old man is admitted to the inpatient
It's okay. You got
facility.
your mic. Just press the yellow. I mean the yellow, red, or green button there.
Oh, I see. I got you. Okay, good. Thanks.
Okay. All right. So you have a minute per question. Sometimes a little less. Okay. All right. So proceed with the treatment, right? So let's see here next. So that goes back to confidentiality. When breakage of confidentiality outweighs the benefit, right? So if you find someone on the ground, I hope you can provide some care and don't be super concerned about the confidentiality in these situations, right? Um, what else? Okay, next question. Hey guys, we learned about akathisia a little bit yesterday, right? Remember when I said there are two possible answers for akathisia, but there is one that's better. And then if you find the two answers in one question, okay. So good question. Great that this question here. Akathisia specifically. So let's put this way: all the EPSs cogentin other than TD, no cogentin for tardive dyskinesia. akathisia. It will be the second one. Akathisia. You could possibly give cogente, so it's not wrong. And I don't think the test would put that question there with both answers. Cogente can be the answer, but the best answer, a little bit better answer would be propranolol. Okay, but cogente in itself is not a wrong answer. I don't think the test makers would ever put cogente and and propranolol in the same question. Okay, but remember, akathisia, cogente, and propranolol. Okay, it's a hard one. Okay, so there is a myth busting here. Okay. Oh, sorry, I pressed this too fast. I'm sorry, I can't stop right now, but we'll go over this in a second. To encounter questions like this, you have to go from stable to unstable and ask yourself what was added and why. Okay, very good, everyone. So just think about the concept of inhibitors and inducers, right? Remember, carbamazepine, huge inducer, right? So here, when you have topiramate, it may make the birth control less effective. Okay, so any of those mood stabilizers, any of them, all of them, you should be concerned of birth defect. Okay, some less than others, but topiramate also falls under this category there of mood stabilizers. Okay. What do you see or expect? What would be normal in bereavement? Okay, perfect. Yeah, you know, why me? Or why wasn't me? Should I say, right? Go ahead if you have a question.
You forgot to go over the other one with the one
Yes,
before that. I forgot.
yes. So thank you, thank you, thank you. So the question was about QT prolongation, right? So what's the difference? There is a, like I call it the little cousin. There is a escitalopram and citalopram. Okay, a lot of old information out there about escitalopram or Lexapro. Lexapro is the new, better version of citalopram uh, version, right? And there is a compound chemical composition of citalopram that it is different than escitalopram. So some books may still say that escitalopram still does carry similar risk as citalopram, but it's not true. Okay, they are very similar chemically, but it doesn't carry the. I think it's called the S. I forgot exactly the specific terminology, but it doesn't carry as much as of a QT prolongation as citalopram. Now, the
But
citalopram,
that wasn't the answer. Escitalopram wasn't the right
right,
answer.
right, correct. It was bupropion, correct?
Yes, the answer
Yeah.
was
Yes.
bupropion.
So bupropion does not carry the QT prolongation as the other. But I wanted to make the difference between citalopram and escitalopram because there is a lot of old information or not updated in the books that are there in research that's not true. That was the main point that I wanted to drive. But yes, if you are concerned about QT prolongation out of those choice, it is even debatable why not escitalopram or Lexapro. But from the books, we got Wellbutrin as the best answer. Okay, so thank you for remind me of that one. Uh, Survivor guilt. If you have a question, please go ahead and ask.
I just wanted to know if this is being recorded. I usually go back and watch them on YouTube so I can read the
Yeah,
rational. Yeah.
yeah,
Okay.
I did the record.
Okay. Thank you.
Okay, absolutely. Well, moving on to the next question.
Pamela, your mic is live.
Which Pamela are you talking about?
Lewis.
Well, it's
Wow, good job, everyone. There is the rationale. Okay. Take a look here. So using deep focus communication allows the child to become comfortable and communicate with his low stress environment, right? Uh, I if you are able to unmute yourself, please let me know if you're having trouble. Let me know on the chat box. I can't see the other screen, so I'm not sure if someone is trying to say anything or not. Okay, please let me know.
Dr. Lopez, if you're
I
speaking,
can't hear you, doctor.
All right, I was muted, so thank you for letting me know. Though. When you hear irrational thoughts, what kind of therapy do you think of?
Down, I don't know. What?
And someone has a hot mic there. Okay. Um. So when we say Socratic dialogue, l- let me try to put it in a different way. If you say what, if you ask me what is major depressive disorder, instead of giving you the answer, I would say something along, what kind of symptoms do you think would you see in a patient that is depressed? So when you say Socratic dialogue, basically in different ways, I'm answering the question with a question. Okay. So, and that's helpful, very helpful, especially in teaching because we're not giving the answer, but are we trying to let the other person find the answer on their own, because the truth is they already may know the answer. So that's one way of using Socratic dialogue, okay, in cognitive therapy. Um, yeah. Okay. So previous suicide attempt is one of the strongest um, indicator of of concerns of a possible suicide in the future as well. Right now, I want you to be very very careful with this. For the board, if it asks which of the following patients is no longer asking for which of the following symptoms or occurrence, if asking for which of the following patients, and they give you A, B, C, and D, you have to calculate each suicidal risk factor alone for each one. Let's say A, you have a 65 years old, white, so age one, white two, divorce three, with major depressive disorder. So there'll be four factors. B, married male, well, married female, with two previous suicide attempts. So which one would be the strongest? Would be A. Okay. Why? Because A has four factors. And it is crazy to think that A would be the strongest. But for the board, specifically and only for the board, you would pick A. Okay. Okay, perfect. All right. So major depressive disorder is one that you are to think, hey, is any one of your relatives, your mother or father, sisters and brothers, have similar conditions. Two things. One is very familiar. Second thing is that imagine that they do and they are taking Zoloft. You want to possibly use the Zoloft because if it has worked on his mother or father, there is a greater chance that Zoloft could work for the patient. And that is the reason why we always ask about the family history. Second thing, bipolar or schizophrenia, super familial history, family history is very important, very, very important. Okay, for bipolar and schizophrenia. Anxiety is another one. So, no bupropion with history of seizures, no bupropion with eating disorder, right? So TBI would be very questionable as well. But you could give Prozac for bulimia. So that's a cultural question, right? Remember what we learned about cultural questions. Okay. So cultural questions always require a cultural answer, right? So if the question goes out of the way to say if the person is from Brazil, Japan, Korea, any other place, most likely that is a cultural question. Okay. Someone has a hot mic. What do patients with borderlines do? Okay, perfect. Yes, they split, right? You are the best person I ever met in my life. And the next day it's like, I hate you, right? So they like to split for sure. Um, but it is part, don't take it personal. Did you know that even people, the therapist needs therapy after a very structured sessions of a DBT, right? Think of having a room with 25, well, 20 borderline personality disorder patients, severe, right? They will need that therapy. Okay? Yeah, we are going to disagree on this answer here a little bit, okay? Wow. Okay. All right. Yes, as I mentioned, we are going to disagree on this answer here. Let's take a look here on the rationale first.
What was the answer?
I think it was keyed in incorrectly, right? It said
Okay.
only it
Pharmacology
said
alone. The
said
answer,
again,
right answer was pharmacology alone.
pharmacology alone, right? However, the combination treatment may not have been found to be added benefit, and that's why I said that we are going to disagree on this one. This is information from the book, but I think we all would agree that therapy would be beneficial. Now, the question here is, it's what I mean is like, when do you provide therapy? When it's too much is too much, right? And it's really dependent on the patient. So this would not be a very good question for the board, okay? Just because it's very, you can go both ways, therapy alone, or therapy, not a therapy alone, medication alone, or therapy plus medication. Okay.
Yeah, the rationale here seems to say both.
Yeah.
What the
Yes.
rationale
It goes
says.
right. It goes back and forth, and this why this one would be, like I mentioned. This one we would definitely throw this one out. Okay. You know, I like the answer of calling authorities a lot, right? Personally. However, if someone is in your office and you identify the problem and you know the patient is at risk, would you really call the police? Right? I mean, could potentially, but not really. That is part of your job to admit the patient at that point, right? Now the question is, when the answer for the board would be calling the authorities. Well, when the patient is no longer at your office, when you have no control of what, I mean, you have no idea where the patient may be, right? So that would be a good answer. But when someone is at your office and you have control of the situation, in this case, a clear cut would be to admit the patient. Okay? Let's take a look here. 1 second, please. Okay. So yesterday, I made a very specific warning about carbamazepine and lithium that both could cause hyponatremia, right? So again, this question will be kind of unfair because it actually can be both lithium and carbamazepine. But remember yesterday we talked about carbamazepine. One of the symptoms that is more pronounced than lithium would be uh excretion of sodium uh as far as hyponatremia. But does the lithium cause hyponatremia as well? Yes. Right?
Will we see both of these
What's the
answers
answer?
on the?
So the answer for this one would be more in line with the carbamazepine. Would both be possible answers on a test? No, they would not, because both actually can cause the same condition, right? With the
Yeah,
deficiency in
exactly.
sodium. Yeah, in sodium,
Because
right? Lithium, yeah, lithium and carbamazepine both can cause uh deficiency in sodium. However, carbamazepine is more pronounced. So could this be a question on the board? Absolutely not, because both would be actually correct, right? It's not like which one is better here. It's like either is hyponatremia or it's not. There is a certain value, lab value, which whenever you drop, it becomes hyponatremia. So it's more concrete of an answer. So it couldn't be an answer question on the board, right? So it's not like one of those wish-wash answers that are like, oh, but which one's most kind of thing. Okay. Wow, very good. Nobody picked the veracity. I'm surprised. But yeah, autonomy, right? Always ask yourself, are we referring autonomy for the patient or autonomy of your profession? Most of the time, 99% of the time, it's about the patient. Okay. Although this question is not very confusing, but it's all about the patient. It's not about you most of the time. Okay. So on the board, don't get confused about autonomy of your autonomy to prescribe, your autonomy to make decisions versus the autonomy of the patient. Okay. So what someone give me help me out here and explain counter transfer. What is counter transfer?
Is
That
when the therapists are transferring their own feelings towards his previous experience onto the patient.
Perfect. Absolutely perfect. So pay attention to that because last time I asked this question, a lot of people didn't know the answer. Okay. So it's the therapist onto the patient. Count transfers the other way around. Is the patient to the therapist, right? So back to this question, it was about projection, right? So this question was all about projection. Oh, my husband's doing something when in fact she was the one doing something, right? So uh matures immature defense mechanism is something that you should at least look at it carefully, take some time to learn it, and make up some examples on your mind. Okay, I'll share some examples on our WhatsApp group. Or now we are moving more towards the forum, right? That would be helpful to you because they can be a little bit confusing at times. On the board, they would give you always the brand name and the genetic name. Okay, depression, right? So if you don't know the answer, use process of elimination. Ask yourself which are the medications that we could give for psychosis, right? Is motivational interviewing ever um, conflicting or okay? Perfect answer there. I don't remember what the B was. Um, it's a choice, right? But when you have motivational interviewing, it's always rolling with the resistance. Basically, you're not pushing the patient away. You're
yeah.
letting the patient tell you when
And,
he or she is ready.
A and B answers were advising or directing.
Okay, so perfect. So that's usually you just go with the resistance, kind of like, okay, feel the patient out. If they're not ready for advice, don't give one. Okay. Even if it's a good advice, right? Mm, which therapy would that be? Okay, yeah, it's mindfulness, right? Bringing you to the present, deep breathing, right? All right, perfect. So delirium, depression, and dementia. You will be asked about these topics in a board for sure. And usually it's about the time frame. Someone came to the hospital, became confused, never had problems before. Look at delirium, right? Anytime you look at
Well,
delirium, you may
if you
want to,
ask what the first thing you would do would be, and everything about delirium says try to make the place more home, more familiar, make sure there's a clock. And so I picked the having the wife be by him as the first step. And then yes, we need a UA. So was I part right? Because the first thing she's right there,
yeah,
get her to make it more familiar and then get some urine.
right, absolutely. But delirium, it's very, very associated with UTIs. Okay, so on the board for delirium, you look at UA. On the board for dementia, you look at adapting the environment that's more safe, that's with familiar faces, with a clock, the lights on during the day, the lights off during the night. Depression, also called pseudo dementia, right? Because it looks like dementia. The difference here is delirium is very fast, few hours to few days. Depression, few weeks to few months. Dementia, long term, right? And most of the time, irreversible, most of the time, right? Unless if it's a vitamin deficiency, okay? When it says dementia, they always say, they always try to answer the question, but by confabulating, by making up. Depression, they always say, I don't know. I don't want to answer. I don't want to try. I don't know is a very specific answer on the board for depression or pseudo depression. Okay.
But Dr. Lopez, the answer that
Yes.
she's talking about is an assumption. Nowhere in the book said that the wife was not with him. So it's just reading into the question. There's no information to support that she was not with him.
R- Right. I think a lot of these questions is reading to the question, and we have to be very careful and practice a lot not to do that because we have a tendency to look at the world from our own lenses, from our own experience, right? So let's say, for example, I'll put my poor wife here on the blast. Every time we go out in the United States, she likes to have one drink or two before she has her meals. And then we come over here to Korea. Everybody likes to eat the meal right away without drinking. It's like, oh, so she always feels out of place. So she sees the world from her own lenses, in a sense. So when we do read into the question, we put a lot of our knowledge, a lot of our experiences, a lot of where the places that we work, how they do things, when may or may not be necessarily the truth. So only use the information that's giving. Okay. I cannot see your hand there, but if you have a question, please unmute yourself.
I'm new here. This is my first day, and as you all are like reviewing, I guess, content that you probably went over, do you have a content review for your course?
Yes, I do. I do.
Okay. We're
Unfortunately, I
gonna go
cannot
over
see
it
you.
after.
Yeah, yeah. We just take a round and then we'll talk more about
Okay.
after. Okay. Thank
Okay.
you. I'm using a different screen, so I often don't see who's raising their hand or things along those lines. Okay. Oh, no. Hopefully, you guys can see it. It's pretty small. Sorry, guys, I couldn't enlarge the screen here for this one. Take a look on the rationale. So, knowing somatic disease, knowing malingering, what else? Factitious disease, super important, okay, for the board. So make sure that you really, really know those conditions and are able to differentiate between them.
At this one, I don't understand. Sorry.
Oh, I wish I could stop. I can't stop right now. Because once I press it on, it goes on. It's a very common occurrence in psychiatry, this question here. Very, very common. Okay. So why? Let's take a look here on the rationale. So it's all about the half life. Yesterday we covered a lot about half life, right? So the shorter half life, it's more potent, but also less. Uh, it's faster, right? So it causes less drowsiness, right? So compared to zopidem has an elimination of half a life of 2.6 hours, and the other ones is a little bit more, right? So if you want something, then the questions what you have to ask your patient is, do you have trouble going to sleep or staying asleep? Or it is the problem of drowsiness in the morning. And then you pick the medication. If it's trouble going to sleep, you want a shorter half a life, more potent to get patient to sleep. Once the patient is sleeping, they don't have problems staying asleep. If the problem is waking up in the middle of the night, then you pick something that's longer, half a life. So the patient doesn't have a problem going to sleep, but the problem is stay at sleep. Okay. I like to do both of these medications, so Zalepion and also Zopidem. But I also like Atarax, a little bit of Atarax, 25 milligrams. It helps for some people. Okay. So this is a cardiac intoxication, right? So if you look at the heart rate is increased, the unresponsiveness of the patient as he arrived, uh, here is more of a full rationale for this question. But again, it would be a very difficult question to answer, right? Very hard.
What's the correct answer?
It is a cardiac issue. It was a cardiac involvement in this case.
Yeah, and the other option was CNS toxicity, which that's what I thought inhalants did, was basically melt your brain.
It does, right? It does as well. That's why I said this one would be more of a difficult question, but this one would be cause more ventricular dysrhythmia. Okay. Hard question, isn't it? Okay, so let's take a look here on the rationale. So, disruptive mood dysregulation disorder, or DMDD, is something that you will see on the board. One of the children-like conditions, right? Um, and adolescent, of course. It's, anytime you hear DMDD, I want you to say, I want a questionnaire, a mood questionnaire, possible. Okay. It's characterized by the chronic, severe, persistent irritability, right? Energy, angry mood accompanied by frequent tempered outbursts. Think of this more of a bipolar-like condition,
Yeah.
but for the younger adolescent children, age time frame. Okay.
I have a
Now
quick
we have
question. Who wants to answer then?
hold on a sec, guys. Let me just finish here, and then we'll go to questions on this one because this one was a bit difficult. So, how do you differentiate and how do you see what is what, right? So the diagnosis can occur with intermediate explosive disorder, oppositional defiant disorder, or bipolar disorder. So therefore, individuals with symptoms meeting any of those criteria of DMDD and intermediate explosive disorder or positional defiant disorder should only be assigned the diagnosis of DMDD. Now, if you go to the DSM-5, you get the full explanation of this condition. Okay, it is a complicated one, but for the board, I want you to summarize it, this condition, in a way that you can remember. One is, why do we have this condition? Initially, we didn't. There was added on recently in the past few years, right? It was not, I don't think it was part of a DSM-5 4, but it is part of DSM-5 5 now, right? I could be mistaken on that one, but it was recent. And the reason was because a lot of people, a lot of the providers were diagnosing younger children with bipolar early on. If you diagnose someone with bipolar, you would exclude them from a lot of opportunities in life, a lot of jobs opportunities. Well, what if you got it wrong? Right? So this why DMDD was created, so that you don't label someone that's bipolar like, less than 17 years old, with bipolar diagnosis. Okay. So very hard question. For you to fully understand this question, you would have to go back to the DSM-5 and look at the diagnosis criteria and tease it out. Everything. It cannot be X, Y, and Z. It cannot be X, Y, and Z. So it's more of a diagnosis of exclusion. Exclusion. Once you excluded everything else, you have arrived to disrupted mood dysregulation disorder. Okay? Because a lot of those conditions, they look like they may present with a very similar presentation, and you have to be very careful separating them. So, what questions can I help you on this specific question here?
So the only thing I know, it was DMDD. I picked that one, but the problem is that the way the question was worded, it said intermittent explosive rage, right? So I'm thinking, okay, like with intermittent explosive disorder, they have intermittent rage
Yes.
burst, sort of. So it's just the way that the question was worded. I think it was the
Yeah.
same one, sort of like the same one with the morphine, and it said that you're gonna give the patient the morphine for somatic disorder. So I don't know if maybe it was just the question itself that was worded
Yeah.
incorrectly. I'm not sure.
No, this one is a difficult one because you have to know the DSM-5 in detail in order to answer this question one, this one correctly. Okay.
So
Clover.
what was the answer, Dr.
It's just because
Lopez?
it kept saying intermittent explosive rages. So that's the only thing that kind of like threw me off.
Yes. I don't remember what it was, A, B, or C, but I was trying to explain the DMDD to make it a little bit clearer. Let's move on to the next question. Okay. Take a look here. The rationale. Not something that we see very often, right?
Never read that anywhere ever.
What is it? I mean, it's not alcohol, it's not cocaine, it's not marijuana. I mean, is there some new?
It's PCP. It's PCP.
PCP.
Well, I'll be darned. Okay.
Yeah, PCP.
I've seen this
Not
question
something-
before.
Yeah, we don't see that very often, right? But someone
And the
with PCP.
nystagmus is a real tip.
Say it again.
The nystagmus there is the real tip.
Yeah, that's
Yep.
the only thing that I remember from my first semester. We had this question, and that's what I
Oh.
already automatically knew.
Oh wow, that's good. I mean, if you see someone on PCP, I like to think of them as the incredible hook because they get tased and they don't go down by the police. They are like able to they get this energy from somewhere that the police cannot even. It needs like 3 to 4 minutes to hold one person down. And that's the image that I always have in my mind because I've seen some situations that someone on this kind of drug and being unstoppable almost, right? But look at those nice segments. That was the cue for this question. Okay, very horizontal, sometimes vertical, nice segment. It is in the hypertension as well. Okay, very high there. You have to ask yourself, what is cognitive therapy or talk? What's done during the therapy, right? So you identify the negative behaviors or cognition, and you substitute it with positive thinking, right? Okay, that is a identification. But let's take a look on the rationale. Okay, those immature defense mechanisms, they are hard. They're very hard because you can tell yourself to go one way very easily when they may or may not be the right answer that they are looking for. So please make sure you look at the table that it is in the PDF, and you identifying those defense mechanisms. And the best way is for you to make it an example of them. Okay, of each one of those. I know there are a lot. Perfect. Okay. Let's take a look on the rationale for this one. There's nothing physiological here, right? Um, Nothing with the body itself, but more of a psychological issue, right? Especially parental rejection and neglect, right? So it's almost like if I can't find my niche within my family, then I'll go out and do some bad behavior in a sense, right? So like as long as they get what they want, that's what's important for them. So the problem here is that if we don't take care of this early on, they they may become a antisocial personality disorder, which becomes a bigger deal later on. Right? We'll do up to 70 today, guys. Okay, slide number 70. Okay, perfect. Most of you guys, even if you didn't know this answer, you could use process of elimination. Would you give bupropion to someone with epilepsy? Right?
No,
So
contraindicated.
contraindication. Then you have the yellow and the blue option there. Would you give those medications to someone? What is the reason that you would give an SSRI over any other antidepressant to someone with suicidal ideation? Because it's
Because,
safer.
yeah, if they overdose on TCAs, they can kill themselves.
Exactly. So you could use process of elimination this question. Okay. So about metabolic syndrome, we covered metabolic syndrome yesterday a lot, right? You need two signs to call it metabolic syndrome. Two symptoms, right? When you encounter a question about metabolic syndrome on your board, I want you first, and it says the patient is stable, think of, is that something else that I can do? And this something else that I'm referring to is offer exercise and diet before you change a patient that is stable to any medication. This answer might surprise some people, but here we go. As I mentioned, right? It might surprise some people. Now, book answer here. Okay. So here we go. Here we go. Okay. Remember, what's the first sign of metabolic syndrome that we discussed yesterday?
Weight gain.
Close, but not really. Waist circumference, right? Taping. Don't fall for BMI.
I have a question. If that last question would have had the word Asian instead of Mexican American, would that have been the answer?
I'll answer that in just a question. Just a second, please.
Okay.
So before I answer this one, so what was your question again? If the last question had the word
Oh,
Asian,
if
is
it had
that
word Asian instead of Mexican American, would that have been the greatest risk?
I would highly disagree. Does anyone has any thoughts on on this answer and on this possible answer? Why would you say Asian though?
I don't think so. Asian, we
Yeah,
don't see a lot of Asian.
at all. I
Uh-uh.
mean,
Oh, sorry,
yeah.
mistake. They have the
Okay.
lowest incident. I'm thinking of a different.
Okay.
Yeah, yeah.
Okay. Then the lowest incident, I would say Asian, but that could possibly be, Asian. Usually, I'm in an Asian country right now. It's very tan. They are not very big,
And
right?
mhm.
So yeah, if it would be the least,
Yeah,
possibly.
I meant to say if the question said it was the lowest,
Oh yes,
would
yes,
that with Asians would have yeah, sorry.
yeah. Thanks for clarifying. So back to this question here, desensitization. That is the core of all traumas, right? So think about this. It's like you're fearful of anything, but you do it, and do it. You take your task over, and over again. It becomes normal. The more you do it, the more desensitized you become of your fear. So that works for EMDR, exposure therapy, cognitive therapy also works on that principle of for PTSD. Obviously, for the board, we're looking for EMDR, but the core of that will be desensitization, right? If you're fearful of a spider, I would show you a picture of a spider, and then I'll show you the picture of a spider closer to you, and then eventually a real spider, progressively getting you less and less fearful by repeating the event. All right, we will have two more questions and we'll call it a day. Okay. Oh, this important one, guys, for the board. Okay. Although the answers are not what I want to talk about. Okay. So I want to emphasize a few things here because this question can be a very similar question. There will be a very different answer. Okay. So when someone asks you to do a series of seven, which part of the MMSC would that fall under? Anyone?
Attention, concentration,
Thank you.
calculation.
So, yeah, so thank you. So write that down, very high yield. Okay. Another one, when someone shows you three objects and within 1 minute ask you to repeat those three objects.
Recall.
Ooh,
Registration.
Registration.
registration. Okay. And a lot of people call it recall, right? So registration or recognition, either one, registration, recognition. Now, when somebody asks you three objects and ask you to repeat it within 5 minutes, then there would be
Recall.
recall. Please don't miss those three easy
Mm-hmm.
questions, okay? Please, and it can be a little bit complicated, especially if you're like, in the middle of your test, it's kind of getting tired. Read the question carefully because you will likely to know the answer. Okay, so this will be the last question of the day, and then we'll discuss a few more things. Okay? Sorry, I cannot zoom in on this question. Oh, here you go. Okay. So let's see at what a B was. Okay. Let me give you an explanation here. The rationale, right?
Are the
So if
questions ever that
yes,
wordy?
go ahead, please. Go
Are
ahead.
the questions ever that long?
It could. It won't be all of them, but it could. You will have few of the questions that are that long.
Okay.
Okay, not very usual though. What I mean by that, you might get 10 of those. That's 10%. Okay, last question. Okay, and then we'll call it a day here. Okay. Sure, they would have poor academic performance, but I think the most part that we want to care here is the familial history of alcohol use, right? So, hey, I don't have the final woohoo board today, but Gen, Gen, Jerisi, Yori, TM, TB, and EH, you guys rock. And then we have there Pam, 3 in a row. Good job, everyone, today. It's 100 questions. We went out. We had about 5 hours yesterday, maybe 4.5 hours. So it was a very long night for many of you guys. As we're coming up for the Thanksgiving week, um, take care of yourself. Take care of your family. It's life. It's not all about studying, right? I know studying is it's what's keeping you up at night at this point. But take care of your loved ones. Be kind to each other. Support each other. I'll be very. I'll be posting more questions and content on the board on the forum of the course. Okay, on the forum. I think we're moving to the forum more than a WhatsApp. We'll be on the WhatsApp because WhatsApp is nice and quick and fast. But as I'm thinking, we're moving towards the forum. It'll be one more secure for you to share your thoughts. Two, it's more focused on study, right? Because how many times we are on a WhatsApp, we want to read something, and then the phone rings or text message comes in, and then we get distracted. So all things that I try to do is with you in the upfront mind, like how can I make it better? So if you see a suggestion, please tell me and I'll look into it and see if it's possible to implement. All right. So if you see something that can make us better for you, I'll be very grateful if you can share your thoughts. Always, whether it's good or bad, it's all good. There is no, you know, I think if someone has a problem, it's a valid problem. It's never, oh my God, you criticizing. I never feel that way. I feel like if you have a problem, I look for ways to fix it or help. So just send me an email is best. That brings me the second thought of always, please send an email because we have 20 different social medias all over the place. That means 20 different inboxes. Uh, too many for us to keep up. So I don't want you to feel that didn't give you the attention that you deserve. So the best way is email. Okay, emailing usually is the best way for me to get back to you within a few days or 24 hours or so. Okay, and then we also there is this crazy time frame. It is Sunday morning here in Korea, and for you guys it's Saturday night, right? So there is this 12, 16 hours difference for communication different ahead of time. Okay. Clover, you have a question
I
there?
have.
Thank
Mhm.
you, Dr. Lopez. This is my
Yes, my
first
pleasure.
time. And thank you, Jerry, for sharing in the group, in the university group. Thank you. I saw it like last minute. Is there a way to
Oh,
join a group Yeah, she
Yeah,
shared it.
same. I need to
Jerry
join.
shared it to the group. And thank you, Jerry. Is there a way
Yeah.
to join
So
You're
the
welcome.
platform?
so I'm not entirely sure if I'm answering your question correctly. So when you say we have the Facebook group where we try to entertain everyone and get everyone thoughts and and things out of their mind and on that group that's open for everyone else. But we have this private group that it's the WhatsApp and also the forum where we have our course. People finish like module one, then they go into the forum and they were able to, like right now, I'm recreating our lecture for module one. Let's say we just went over the brain. So I'll be posting there, hey, what does the frontal brain do? What's the parietal lobe does? Whatever might be the question. So I can get your mind spinning and answering those questions to get you better prepared for the board. So if your question is, how can you join the course? uh the forums and the WhatsApp is part of the course. So it's not open for everyone else. Because if we open for everybody else, then we can't devote the attention for those people that are in
Right,
the course. Okay.
right.
So and
Mhm.
plus we wanna, that's why we have the Facebook. That Facebook is for everyone. The WhatsApp is more exclusive, and we're moving to a little bit more exclusive in the forum so that I can focus on the people that are in the course. Okay. Did I answer your question?
Yes, so I would mean the both the Facebook and the forum, like the exclusive ones
Yeah.
as well.
Yeah. So we'll go ahead and discuss that in just a second, a little bit more. Let me just answer a few more questions here for those folks that are in the course, and then I'll get back to you in just a second. Okay.
Okay.
As far as Yeah, as far as anyone else from yesterday or anyone else that's in a course right now, what are is anything in your mind that's keeping you up? Anything that you don't quite understand, you're still confused, or you need a little bit more support?
I have questions about tonight.
Yeah. So just hold on to tonight questions, and we'll go back to
Okay.
that. Okay. Thank
Hey,
you,
Dr. Lopez,
Victoria. Yes. Hi.
sorry, I just
Okay.
finished the modules for training 4,
Yeah.
and I
Hi.
did the first question, the first questions on the test bank, and I just thought that a lot of the questions there were not on videos that I watch. What do you
Right.
recommend?
So good. So the yes and no, right? So there is a specific question bank and there is a broad question bank. So I am assuming you are referring to the broad one, correct?
No, I thought if I'm doing this incorrectly, then I guess I am. But no, I finished the entire module 4, and then I went in the test bank page, and I was doing the module 4 psychotherapy and related. I thought there are specific ones to the modules that I just watched.
Oh, okay. Yeah. Uh uh, I try to develop two types of question banks. One that's more specific to the things that we cover, and the other one is to give you a spin for your money because you will see questions that we didn't cover on the board, you know, and that's and that is and that is something that we can't stop it because if we are going to try to cover everything, then nothing becomes super important. What I suggest? I suggest you highly focus on module 4 and doing the first set of question bank, and then move to the second set, knowing that there will be more difficult. There will be questions, let's say, about herbs, which doesn't fall on module 4, but we can't cover 30 different types of herbs, but we can cover one or two, maybe three that are high yield, right? So it could be possibly that you get a question on a herb that we never seen before, right? Like goat, uh, some kind of weird herb. So it's important that we don't cover everything but focus on a high yield. So to answer your question, let me better show you the question bank. and then and then it'll confirm you if you are doing the second one or only the second one and not the main question bank. So one quick second, okay? Let me log
Okay,
in.
thank you so much.
Yeah.
Doctor, can you guide us how to find a question bank?
Yes,
Like I'm
absolutely.
online now. I can actually click in and find it as usual.
Yeah. So the question bank is separate from the course in a separate website. So everything else it lives on a website that we have for our course, and the question bank it's a different website, different login. They don't communicate. Okay. So one second, and I will show you
Oh, I
exactly
see.
where.
And we're almost out of medicine.
You got someone has a hot mic there. I don't want you to talk about your business there. I'm almost logged in, and then I'll show you.
I've got one piece. One. But you like
So,
to.
so that's a separate email to get into the question bank.
Yes, it's a separate email.
Okay, let
Separate
me look.
email, separate password. I'm almost there. So
So the password is in the email that was put into that particular question bank.
yes, so you have to look in your trash bin, and I can almost guarantee you that that you do have a login. It's maybe you just went to the trash bin and you never seen. But regardless, you can also go to the website and request a new password, and then automatically the system will send it to you. And give me one quick second. Now I am almost done here.
Did you get ginger ale? One can, some charity.
Your mic is open.
Sorry, guys. Someone has a hot mic there.
Dr. Lopez, while that's loading, I have
Uh-huh.
about 6 friends from my school that want to buy your review. Do you have any
Yeah.
discount codes that's going on?
Uh, not currently. We may. I'll find something. Okay. So money should never be a something that stop anybody from getting better. So we'll have actually Black Friday coming up very soon.
Okay.
Um,
Keep me
yeah, I think
posted.
that would
Thank
be.
you.
Yeah, send me an email, please.
I will.
Yeah, because that way I can communicate directly with you. Guys, one quick second, please. I'm so sorry in this setup. All right. I'll be sharing my screen. Um, I'm in now. So once you logged in, right? So you go to the main page or the question bank page and you logged in. Okay. And then you already logged in. So where's your login? You log in, look at your look at NP exam coach, go to your trash bin, and I can almost guarantee your question bank password will be there. Now let's say you actually start uh, I have a different settings here than you. So let's say here. It's a little bit different than you guys seeing my screen or no?
Yeah, we see your
No.
screen. It looks very different.
Yeah. So one second. So what I wanted to show you here is the session.
I've never been on this site.
Okay. think I'll need to log in as a student so I can better show you. But one second here. So this is my back end, what I have to work to get things correct. But okay. Oh, okay. Never mind. So here what I wanted to show you. So see the first question bank. It says number 1 here. Jovan. So this number 1, right? It will be a little bit different for you, but regardless, the first question bank, it says comprehensive. Okay. So under the comprehensive, there are 5 modules. If you go to module 4, will be this one, right?
Right.
Now, if
Psychotherapy.
you scroll down, there will be a module 4 here called it'll be here the it has to match. So the psychotherapy and the related theories. So I'm assuming that you're saying these are very broad, which is absolutely correct. However, if you go to module 4 of the comprehensive question bank, it may mimic or at least seem a little bit more familiar to you.
I don't think I have that option, Dr. Lopez, because on my test bank, when I go there, I have, the PMHNP question bank. It kind of looks the same as yours. But then I do have number 1 is a comprehensive question
Right.
bank, which is not what I'm doing. And then number 2 is module 1 for scientific
Right.
foundation, which I've done those. So, and then I'm now doing, it's under number 5, module 4, psychotherapy and related,
Right.
therapy, whatever.
So
So I did module 4, block 1, and the questions were kind of the same questions that I've seen before in school and stuff, but they're not specific, because the reason that I like your videos, because it's everything that we actually need to know. And so the
exactly.
questions are very broad, like asking you aromatherapy, what kind, like I didn't remember
Yes.
seeing a video like that. That's why I was wondering.
No. So what I would like to ask is for you to share your screen, because I think you are missing a very important point.
Okay, sure.
I
I'll
think you
share
are.
my
I think you are missing the most comprehensive questions possibly. So let's see. Let's see what you're seeing, and then
Okay.
we'll troubleshoot that.
Okay.
Thank you for sharing that.
Dr. Lopez, I go to the question bank from Magic Link, and I'm in Google. That there is Experienceify, isn't it? I have
Yeah,
never
like
found an
so
Experienceify.
there is no question bank yet on the Experienceify system.
Oh, okay.
Which
Well,
is
mine doesn't look like that.
yeah.
Let me
So
bring
do you
it
know
up.
how to share, Jovan? Yeah,
Yeah,
she
I
does.
think,
Okay.
can you see it? Let me
Yeah,
go there.
it's coming up. One
Okay.
second.
I don't know if I have authority to share here.
Yeah, you should. Everyone
Hang on.
should.
Yeah, because it's on my end, it says that's presenting.
Is anybody else seeing there?
No. It says presenting, but that's it. But it's not showing anything.
I think you got to share your screen. There should be an
No,
option.
I
for-
did. I
Oh,
did, but it's just saying presenting and even saying stop presenting. Let me see. Hang on. Yeah. Me on my end, I see it, but I know you guys can't.
Hmm.
Let me see.
So just to make sure,
Let
there
me
is a
just send you a picture on the chat, what it looks like. Maybe I can do that.
yeah. I don't think you can send the image in the chat,
No,
but you
yeah,
can
it won't let
try.
me. It won't let me.
Yeah. So let me stop. Let me.
Yeah, maybe you have to stop sharing yours, because on my end it says that I'm sharing.
Okay. So. Oh, that's you, right?
Okay, yeah. So I switch over.
Okay.
Can you guys see it?
Yeah, I can see your email though. Okay.
No, but I switch. It's not letting me. Hang on, let me go back. Hang on. Yeah. Okay. All right, let's try that.
That's the wrong side though.
I know. It won't let me switch. Hang on. Oh, hang on. I saw how. Give me 1 second. Okay. All right. Share. No. Okay.
Yeah.
All right. I think it's gonna work now.
Yeah, here you go. Perfect.
Yeah.
Now, now if you go back under 1, if you click number 1, here you go. Now go to number 4.
Oh, okay.
There you go. There you go. Press that, and you are in.
Okay, but so that says, that says comprehensive review. And so the ones that I was doing were general, and that is the one.
Yeah. Yeah. So you need to, those might be over 600 questions. So basically here, I want you to do like module 1, go to the comprehensive review module 1. When you finish comprehensive review module 1 for questions, then you do broad. I should have called it better. It started from module 2, scientific foundation. So right now you are on the comprehensive therapies and related theories. There are probably 200 questions there, maybe 150, something like that.
Okay.
They are very similar to what you learned. Okay.
Okay. Thank you.
Absolutely. Thanks for sharing. Very important information there.
Doc, I don't have access to that website.
Okay.
I
So
checked my email. I don't have a link
so
or anything.
please 1 second. 1 second, please. Caitlin, could you please share your email on the inbox here, and then I'll go ahead and double check. Just yeah. I don't want to go do this. I don't want to do this right now, but I will email you back. Just send me an email, and then I'll troubleshoot your account. Okay. Just send me an email instead, so that way I can troubleshoot. Lordine, do you have a question there? Anybody else has a question that I can help you with?
Rebecca Parrish.
Hello, Rebecca. Hi.
Hey, the screen she just shared, that's not what I see when I go to the question bank. It looks different. I just want to know if I'm in the right place.
Yes. Could you share your screen?
I'm at Get Learn Worlds, but let me share.
Oh, yeah, please share. Yeah, even if you're there, it should take you to the course.
Select a tab. That one.
Do you know how to share?
Yes, it's coming.
Okay.
That's what I see.
Thank you. So, help me on this. It is the same thing, right? So if you click on
the same, it didn't have the green and the, it wasn't exactly the same. So I thought I might be in the wrong place.
No. So if you see under the tree, under the tree, the number 3 there, there is this arrow. So if you click the arrow, next, here you go. So that'll be 3. If you go up to number 1, now click on the arrow. Here we go. Now you can go comprehensive scientific foundation, comprehensive advanced, comprehensive diagnostic, comprehensive psychotherapy, and comprehensive ethics principles and so forth.
Okay.
Now,
well, good.
Yeah. So then down under, it's all the very broad questions, right? Like, oh, you might get something about aromatic therapy. No, we didn't cover, and we're not going to cover because you may not see it, but we don't have a crystal ball to know for sure. So let's just make sure that that you're good to go, right?
When
And
I
also
get those, I collect them and put them on the end of the corresponding notes I've taken from your PDF. I put them in on the end of my notes as a point of learning. You know
there you
this
go.
too.
There you go. That's very effective. Yeah. And I know you also do the flashcards, so you
Yeah,
should
I
be
do.
good to go.
Yeah.
Yeah.
Okay, I'm gonna
Okay.
unshare. Oh,
All right. So, side note, I'll be adding a few flashcards, maybe like a 500, 700, maybe by tomorrow for the brainscape. So that's extra stuff. It's not needed. I think you have more than enough that you needed, but I'm always adding things to the course. So be on the lookout for that. Using
I
more of the
don't
forum.
have Brainscape. I use Anki. Are you
Anki, right?
making me
So
up for that too?
I
Did
can't
you
make
not-
Ankies, but I can't make Ankies.
Okay.
That takes tons of time, but yes.
Okay.
Yeah.
I don't have
Uh
Brainscape.
yeah, I can probably direct you, but we'll take care of that. Anybody else has a questions or anything else that I can help you with?
You're gonna help the new people, right? In a second.
Yeah, I'm gonna help in the new folks. I don't want to bore the
Okay.
students that have been with us for a long
Okay.
time and
Okay.
Okay.
talking about the course.
I have questions about tonight.
Sure, go ahead.
Okay. The question where the old fella has the hip skin graft. If I understood the rationale, it's don't send him for psych, but continue medical care only because he might not like psych referral. When the beginning of the question says it was a somatic complaint and he needs a psych referral to try to help him deal with this.
Okay,
But
so
the
I
answer
don't.
was continue only medical.
Yeah, so I don't think you got the question correct, and I don't exactly remember the question, but I think the emphasis of the question it was that do not give him more narcotic because he exceeded his amount of narcotics. So this is more of a psychiatric condition rather than uh giving him more narcotic. But again, we would have to go back to that question, and it would be difficult to
If you
find
can
it.
look at it, because I believe the answer said no psychiatric referral, continue medical care only. So he's comfortable with it.
Yeah, yeah. I don't. We would have to look at the
Just say
question.
to give him methadone. That's all it said. That was the correct answer. That says start him on a methadone treatment.
Yeah. So there's another, heavy drug.
Yeah, would have to look at the question specifically to
Okay.
know.
Okay, if you
Thank you,
can.
though.
And then
Yeah.
there was a question that had identification defense mechanism. I've looked and it's not on the PDF as the 7 defense mechanisms. Identification is
Uh,
not.
so you are confusing here defense mechanism with ethical principles, right? There are 7 ethical principles. Defense mechanisms, there are tons, over 100.
Oh, that's
But
right. That's right. We only
yeah,
have the
yeah.
7 basics in the PDF. That's right.
No. But that's the ethical principles, right? Veracity, beneficence. So, but I put in maybe 23 most high yield. Even out of the 23, I would pick like 4, maybe 5 to really
Well,
know them.
the question was defense mechanisms because he was abusing his wife and daughter because
Right.
he had been moved that way. And it
So I
said it
have a
was
chart.
identification.
I don't remember which module, maybe module 4. I have a chart that is at least
Yes,
25
module 4.
different yeah, 25 different mechanisms there. And those are hard. Okay, those are hard. I would focus only on those that I have in there because there are way more. I would
Right.
focus
And
on those.
identification is not on there.
Yeah.
No,
So I don't
PDF.
remember, but yeah, I don't remember, but yeah, that's one of like I said, there are tons of them. So
But that's right. On that case, I was trying to stick with what you put as the most heavily identifiable ones because I did see that it's like the list is endless. It's not like
it
DSM.
is.
There's this many diagnoses and that's all there are. for defense mechanisms, the list seems endless.
Okay. Yeah. So that brings me a very important point. So one of our students just passed last week, and she's like, Dr. Lapa, I was crying in the middle of the test. I thought I failed, and those are like, I knew she would have failed. I mean, she's had been a very strong student, and studying very hard. I knew that she'll pass. But is it really true what you're seeing? Is that really reality? What you're seeing and what you're believing it is, right? So, although we want to get 100% of the questions, do not despair in the middle of the question, the question, because what happened is in every test, 100% of the time, it will be 25 questions. There are will be 25 questions. There are dummy questions, right? So there are not valid questions. So it will be questions that you have no idea, right? Came from nowhere. So it could be those questions are bothering you when you are getting fact 150 right, 140 right, but you sticking with the feelings. It's almost like things that hurt you. It kind of have a bigger impact than the things that make it, you feel better, right? It's like, oh, uh, you know, somebody said something negatively, although the person has done something good the entire year. So that the negative impact from one occasion is took with the person more than the whole benefit that the person has provided for the whole year. So when taking questions, my point is do not despair. Because one, it could be dummy questions, it could be not valid questions. Two, it could be will you have room to pass even if you get it incorrect. So stay focused, pick two answers, cross the other two answers, save the question, move on, keep repeating the process. At the end of the question, at the end of the task, you may have 10 different questions. At that point, you're like, you can take those questions. I don't need them. you know, uh, basically. And then when you go back to the question, you may have a different insight. You may have less you choose from. Instead of a four answers, now you have two because you already did the process of elimination. And keep focus. If you're feeling tired, take a deep breath. You have time. Okay, you have time. So uh, that's another reason why it's so important to do the diagnostic test, which is different than question bank, right? When you are doing 175 questions at once, is very different than doing 20. Okay, so learning to pace yourself is
Yes,
very
it is.
important. Yeah,
But that was
learn.
one of the questions tonight was take a deep breath. I'm here
Take
with
a
you.
deep breath. That's it. Take a deep breath. You don't have
Yeah.
to get it all. Don't be like the CRNA students. That every single question they have to fight for, and making a big deal for every question. It's okay. We have room, and we are working with 90% of the things that you will see on your test.
I
Sure,
have
we're
one
not going
little,
to.
yeah,
Yeah. Go ahead, please.
the dump sheet. I just want the basic idea of it. When you go into the room, you're going to have 20 minutes before test time, like for everybody to get there, I guess. And they hand you a slip of typing paper and you can have a pen and you dump everything on it. Is that correct?
Yes. Did you watch a video that I made and I did a dumping sheet? It's
Yeah, I
way
have it, but I haven't watched it yet. Yeah.
Yeah. So it's way more than what you need, right? But why did I put away more? Well, because I don't know exactly what are your difficulties. Is it Erickson stage? I would put the Erickson stage. I would put the medications that causes the acronym for the medications are inhibitors. I would put the acronym for medications that can cause depression and mania, only the acronyms because I don't need to see the whole thing. I have the whole thing in my mind. I just need to, oh yeah, sickface.com or drop act scam GBS. And then I'll just look at the acronym and like boom, boom, boom. Right. So
At beta bits. I've got that a lot of my acronyms that are long, I plan to dump them, get them out of my head. And they're
yeah,
right there in
just
front of
put
me.
it, yeah, just put because the one that comes to question 170, you look at the Erickson stage, you'll be like, oh yeah, the age match. Yeah, here you go, boom. makes it so much easier. So much easier.
Yeah,
You
like
don't have to
Thorpe's
self-doubt.
the cow will poco. Yeah, I figured to
Yep,
dump them, get them out.
that's a good one. Yep.
Yeah.
So
Okay, that was all my questions. Thank you so much.
absolutely. Okay. So anybody else from our students now that are there are something's in your mind is bothering you next week, we will not have a live class. You have your schedule, right? Study hard, guys. Study so hard because the more you study, the more confident you feel. The more you study, the less anxious you feel. And your best life is about to happen. 2025 is going to be a great year for all of you guys, right? You transition from a bedside nurse to a prescriber. And that is mind blowing. Such a better life. I cannot even describe it. Okay. So look and be kind to yourself. Like, hey, you worked so hard. You went to your nursing degree and then you accomplished your master's or your doctor's degree. What do you want? You want a new car? Do you want to be kind to yourself? You want that good vacation to Australia or any other place? Go ahead and book that up. You know, go ahead and do it. I mean, it's your way of saying thank you, right? Whatever you want, and obviously you can afford. Don't get in debt, but be be like, this is what I do. This is where I'll get it the day after my board. Just sign up for it. You know, because you deserve it. Nobody's going to take nothing away when we die. Go ahead and use it up responsibly, right? But you worked very, very, very hard to be here. Very, very hard. So
Just the concept of it blows me
yeah.
away. I've been a nurse since 1992. I'm 64 years old and just
Oh
graduated with
my.
my MSN. 64, did I say 62? See,
Yeah.
2 years went by during school. So just the concept of going from one side of nursing to the complete other is mind blowing.
Yeah. So, can you help me understand what made you wanting to do this at the later stage of life? What's your goal?
Well, it was unusual. I had been for 10 years at a women's prison, and the medical
Oh, wow.
department changed hands, and I lost all of my retirement. Well, 2/3 of it. They had paid 2/3 and they took it back. And so
Oh
I
my.
had no retirement, no nest egg. And I worked with the same psychiatrist for 10 years, and he said, "You're going back to school. You're going to be a nurse practitioner. You need to be a PMHNP." And he talked to me and encouraged me and uh, pushed me into
Yeah.
the college door, and so there I went. So instead of getting a chair on the porch and retiring, I'm going on.
Hey, now you can get a chair in a porch at the beach in Florida and do your Italian psychiatry
Yeah.
then.
I have a question for you, doctor.
Yes, please.
How has being a PMHNP changed your life?
The better question, why wouldn't that do? You know, for
That
one, I
migration too. That
yeah, like
migration too.
so I've been an ICU nurse for a long time, right? So I have a so every single day I wake up and I said, when am I going to be a CRNA? Every single day of my entire life, as far as I remember. And I went to school, University of Maryland, you know, graduated, then I joined the army. And every single day is like I can't wait for the day that I go to CRNA school. I did all the army good stuff at war and being a ICU. I deploy with NATO troops. I did all kinds of craziness stuff. I went to several ICU courses, a flight medic, all that. You you can think it. I done it, and I applied. Oh, I would say obviously I got picked up for CRNA, and before that, I got another job where I was the chief for a very very busy hospital, very busy in Washington, and I worked with the wounded warriors. And I said, you know what, I can actually make more of a difference being doing psychiatry than I can do critical care. But I wasn't sure because that's all I done. I done critical care. I mentioned, I get paid to do this. I get paid to go to school. It's part of my job. So I would had been selected, and then like 3 weeks before, I was like, I went through a board. Well, actually, I went through a board. They say, "Hey, I want to take it away. Uh, I want, I want to take my withdraw my package, and I want to put a instead of I want to do PMHNP." And they're like, "Oh, you guys are crazy. You crazy?" I say, "No, no, it's okay for me." And then I did that. The day of my interview, I was late for my interview too because I was doing a code. I was like, well, in the middle of the code, it's like, hey guys, I have to go. So this is new. And like in the middle of the code, it's like, you guys got this? Yeah, yeah, let me leave. So then I was like, hey, I'm in interview here on the phone. It's like, hey, sorry, I was in the middle of the code, but I'm here, you know. So the question is, how it changed my life, right? So I went from having these crazy hours, deploying all the time, and to have the most wonderful life in psychiatry with my own team. I have two psychiatrists who works under my clinic, which I'm in charge of. Um, but the most rewarding difference is, you take care of an ICU patient, you keep them alive, they're living well, gone. You never see them again, right? So I see my patients coming to me with extreme depression, right? Like life is just blah. It's just like, oh. And they'll come back 3 months later. It's like, I don't even understand why I live that way. Well, I say to them, like, when you wear glasses, you think and you don't, and you're not wearing glasses, you think that that's how everybody see, and this is how life is. When in reality, life is not meant to be that way. Life is meant to be enjoyable, colorful, full of energy. So when you are able to fix someone's sleep, everything gets better, right? And so is anxiety, you know. So marriages that are being broken because either the husband or the wife is too anxious, too stressed, and it does not need to be that way. It does not. So if you are able to work those things out, and people that have depression, I would say I would have a hard time to say that I remember anybody that come to my office with depression and anxiety that did not get solved. That's very bold statement, right?
Ridiculous.
Yeah. But I try different things. I stick to the plan. I explain the plan. I get their buy-in, and I have a good timeline when things will happen, when I would expect things to happen. And to me, they come back and they say, hey, I'm living my best life, you know? And that it is so rewarding because it's like, wow, I was able to help somebody else. Plus, I don't have to do crazy. I still have to because I'm on call a lot. But my next job, I won't have to do more calls anymore. So that's great. I'm happy about that. But yeah, so I think psychiatry was the best call for me. I loved ICU. I have to say, ICU had been my passion, but when I started working psychiatry, it's like, yeah, this is it. So, plus a lot more opportunities. Right now, we're looking at open PMHNP ECT training, the first in the United States, in Boston. So that's something new for all of you guys who are part of MP Exam Coach. There'll be when we first open up and get everything square away, will be open up. So that's a great opportunity. A lot of interventional psychiatry that I'm involved in some groups right now that will be open for PMHNPs. So we're trying to open doors, for us, for psychiatric nurse practitioners that have not been open. So I'm definitely involved in that. And yeah, I mean, I love it. I have no regrets of not being a CRNA. I have zero regrets.
Right.
So,
Nice. Yeah,
yeah.
doc. Yeah, I've been an FMP since 2015. So I just like the fact that I'm not at the bedside anymore, and have patients
Exactly.
for every day. There's power in it for sure.
Yeah, yeah.
Yeah.
Even F as a FMP, I was talking to my Yeah, I was talking to my other friend yesterday. He's also in the service. He's like, man, I see about what did he say? I see about maybe 100 patients a week. I was like, oh, I'm lucky if I see 40. Like that's like half of the load. So it's pretty nice to be able to talk to people rather than like what is hurting. Here's the medication. Go to the pharmacy. I
Right.
think it's pretty cool. I think
Pushing a
it's a
cart
blessing.
whole night.
Yep. Even as a FMP, nothing against FMP, love them, but you guys do have a very strong load. 20 patients a day. That's craziness to me.
That's a lot.
You know,
Yeah. Hmm.
I like to take my time. I like to talk to people, understand where they're coming from,
Hmm.
and that to me, that's the best job ever. Can't complain. No complaints about nothing. So very happy.
And some
Yeah.
of the providers I work with, they see about 48 patients a day and they work in cardiology, which is insane.
Yeah. Because it's not about here's your medication. It's not about do you want to take here's the medication, that's what you should do, take 3 times a day, see you like in a month, right?
Yeah.
So very different than what we do. They say, like, hey, uh, can you tell me which medications? I know. Here's our three options. This is what I think. Option one, two, and three. The best plan is the one that you are going to stick with. Even if the option A, I think, is the best, I don't think you should go for that, because if you're not going to take a medication every day, then let's go ahead and do Prozac. And they'll explain why Prozac would be a good option for the patient, and they can either agree or disagree and pick whatever options they feel that's best for them. And I think that's very empowering. I never tell anybody what to do. I just say option A, B, and C. Which one would you like?
One advice that stuck with me was when you're looking for a job, get down the patient requirements and make sure
Yep.
it's not ridiculous. Because you got into this, at this late point in my life, I got into this to make a difference in people's lives. I don't want to do rapid fire dictate what you're going to be doing. Now get out of here. I don't want to do that.
Yeah. And in psychiatry, you have the choice to do telehealth. You can travel the world, maybe, and do telehealth. I mean, you can do a lot of traveling as an RN, but I think with psychiatry is a lot better. So
Yeah, I currently travel as a locums in cardiology for the last 8 years.
yeah, yeah. I mean, nursing in general, there is a lot of opportunities if we start branching out from being a ward or being a manager of the hospital. There is a lot of opportunities that you can get nationally, right? The earlier you do, the better it is. But yeah, one step at a time, right? Right now, I think we are going to see a lot of changes in psychiatry in the next 10 years. And I want to make sure I want to be part of that change, whether it's psychedelics, ECT, lots of ketamine, lots of many other modalities in psychiatry. So as I want to be part of that in different ways. So hopefully, also artificial intelligence, right? How is that going to play out for us, or for the profession of psychiatry, or for many other profession in medicine, like radiologists? Like, hey, AI can look at those images and give me a better diagnosis, right? So how that's going to play out in the next 10 years, I don't know. We are going to see, right? But I can see that a lot of apps I'm working with the one app with the artificial intelligence. What if we could record the patient's conversation and our conversation and get a a confirmation of the diagnosis, or something that we forgot to ask? So that could be a lot of things change in the next 10 years, right? So exciting. I think we're in an excited moment in life for sure. The next 10 years will be with artificial intelligence. I think it will be very different. It'll be like, if you remember, like 20 years ago, for some of you guys that were already born, like people didn't have, maybe 20, well, maybe like 30 years ago, like you didn't have a cell phone, right? Like it was a huge break. Now we have apps, cell phones are a lot smaller, much more affordable. And I think with artificial intelligence, a lot of things would change very fast. So, anyways, guys, I don't want to bore you guys with my rationales, but
I have a quick question. Which organizations do you belong to? Because you know how so many different organizations. So which
yeah,
ones do you feel like are important?
I do ANA because I think it's very important to pay your dues because they will represent you, right? So, like, let's see the power of representation. Please correct me if I'm wrong. Like FMPs in Florida, they now became unrestricted license, but PMHNPs didn't necessarily, right? I don't know if it changed,
Yeah, they
but
they turned the bill down back in July because I got
right.
my autonomy back in 2020, actually, from Florida. But the actual psych one, I was researching that because I had heard through the grapevines that it was going to be approved, but they shut it down. They said they
Yeah.
shut it down. Yeah.
So why they shut it down? Because we didn't get united and made it happen, right? Things move, but things needs money to move. So if you be like, oh, I don't want to pay my dues and I don't want to be part of the organization, you actually missing out way, way more than the $200 that you're paying for that organization because they make things move, right? We are very strong, very, very strong, united. And when we separated, everyone doing their own things, and then you just become an individual and you are going to get what you get, right? Same things with elections. If you don't believe the president, whether one or A, B, or C, don't complain after you don't get the people that you want to represent you. You have to stay quiet because you didn't get the time to vote, right? So the same thing. So I believe ANA. I always join my all local chapters. I'm always usually go once every 10 days or every 2 weeks. I go to a local chapter meeting, wherever I'm at, whether I'm in Washington, D.C., or even locally, internationally. And I also do international organizations. So, but ANA is the main one for nursing uh, that I joined for sure.
Yeah, I'm in
Yeah.
Georgia
It's
and
just
we are
personal
extremely
preference.
restricted. Hoping the
Yeah.
ANA is going to make a difference. We're very restricted. We've got old male doctors that have been in charge for too many decades to let go now, and they turn a
Yep.
huge profit from being paid to be the supervisor for an NP. So they don't want to let go of that.
Yep.
Free
So,
money.
yep, absolutely. It's about turfing, right? So people say, oh, it's about patient safety. Yes, it is. But if you get the education, if you put yourself, if you do the time to learn rather than doing the time just to get the degree, you will see that it's not about safety. It's about turfing. What I mean is that, hey, it's about protecting a, a job area that's always been uh, part of the psychiatry team rather than PMHNPs, right?
Yeah,
Because
that's their
quite honestly, you need to go 4 years to a general degree, let's say physical education. Then you take your initial medical school. When you get out of medical school, you don't even know where you are. Let's be honest. And then you go for another specialization. Then you become a super duper well educated, so psychiatrist, right? So, but it took you like 12 years. Do you really need 12 years? May or may not. For some things, you may, but you too went for 4 years of BSN, then you did your master's, 2 years, then you did clinical, a lot of clinical time. So you can bring a lot of things to the table, right? So it's now some of the schools are very weak. Okay, we have to recognize that you don't need that for the board, but you need a very, very strong foundation for your medications, right? You need a very strong foundation. One, you don't want to hurt nobody. Two, they're very weak at the point where they come to you. They're like, I don't want to do anything. I don't want to live. I'm having suicidal thoughts. So, you know, you you gotta be confident on your plan of care. And three, you want to protect your license too, right? I mean, it is true. You want to do all three things. So the continuing education is important. Okay. So if the psychopharmacology is not your bread and butter, then it's something that you should be taking some time to learn. If if therapies is something that you're weak on, you know, spend some time, do some extra learning, and get better at it. Okay. I know it's easier said than done, but it's something that you have to put the time into it to get there. Okay. Alrighty. Hey guys, I don't want to make this super long. I'll stay with those folks that are having any questions about the course or want to know anything else. But it was super awesome to spend the time with you guys yesterday and today, obviously. Next week, no class, and I'll see you guys the week after for module 2. Remember, everything is available and ready on the course. You don't have to wait for the live classes. The live classes are extra, but even the live recordings is under module 11. So you can watch the previous recordings that we did. When we come live, it's more of a helping you, but it should not be your first time seeing the lecture. At least that's not how I would do it. I would have seen the lectures, studied, and then would come to the live content just to triple check things, But it's available for you. So
Thank you, Dr.
alrighty then.
Lopez. Happy Thanksgiving.
My pleasure. Yes, you too, Giovanna. I see you studying very hard, so keep it
Thanksgiving,
up.
everybody.
Rob,
I
yeah,
need
happy
that.
Thanksgiving.
Thank you, sir.
Yeah,
Same
happy
to you. Bye-bye.
Thanksgiving. Dr. Lopez, don't forget to send me the test link, the test bank link. I sent
Yes,
the email.
would you send me an email?
Airhead, y'all.
Perfect. Thank
Yeah, I
you.
did. Yeah.
I'll do that.
Thank you.
Okay,
Have a
thank
good
you. Bye
night.
bye. Good night.
Okay, everybody, be safe.
Be safe. Take care. All right, folks. There have questions about the course. Would you like to join or any question? What is going on? Please let me know so I can better help you.
How do we get started?
Okay, so basically, I'm going. Do you have access to? Okay, so what is the course? So let's start that way. So we have this course called PMHNP 30 Days Walk to Success. Now, is it 30 days? No, it's not. It's actually 6 months
Okay.
of full support. So it's the most comprehensive course in the market. I'm pretty sure of that. Why? Because it offers the complete review of modules 1 through 5, which is domain 1 through 5 of the AANC board certification. Complete. That might be 100 different lectures, small lectures. Okay. I don't want to okay. So it's a lot of lectures. Then when that's done, we do something special, which is called the PMHNP Crash Course Review, which is a different course, but added to this course as a package. When that's done, we have the PMHNP question bank with over 1,400 questions there. Tons of questions, right? Then to make sure that you will pass, we have the PMHNP Diagnostic Test 1 and 2. And then we have the WhatsApp groups that we can talk to each other on a daily basis, talk to me on a daily basis. And we also have the live content plus on-demand content, meaning that you can do all this without even attending any live course, or you can attend all the live courses and get the recorded courses. It's all together. You can choose how you want to study. Plus, instead of reading a book, I provide PDFs. So basically, I read the books, I digested everything, I put to what is important in the PDF to save you time. So that's one course. I think for you, it would not be how how long you have until your board date. How many months?
9 months. But since you said 6 months, I think I should just start taking it.
Yeah, I mean you could, but I want you to be better at something else at this point. Have you taken your psychopharmacology course?
Yes, I'm in my clinicals. So this clinical is psychotherapy. And then I
Okay.
have 2 more and then I'm done.
Okay, so I mean you could join now for the board. I think I have the strongest psychopharmacology course out there. It's like
Okay.
a year. broke it down into a 4 months work. It is every module comes with the digested videos and PDFs and notes, charts, all kinds of medications. Anything you want to know in psychiatry is in the course. So I kind of would almost suggest you doing that because you can do that at your own leisure, slowly.
Mm-hmm.
And then when it gets to be 4 months to the board,
Mm-hmm.
like in 5 months from now, then you switch to the board specific. Why? Because the psychopharmacology course will not help you for the board as much as you think it will. Because the board is not about medications alone. The board is about therapy, legal principles, things that
Mm,
you don't study on school.
right. Mm-hmm.
Right. So the PMHNP psychopharmacology course, it's about you. It's about medication. It's about you coming to a job and like, ask me any question about medication. I'm pretty confident that I can give you a reasonable answer because you gain your confidence. It is a lot of work, yeah, but it's totally worth it, right?
Mm-hmm.
Do you need for the board? No, you don't need for the board because it's too much for
Is
the
it a
board.
part? Is it a part of your like all the other review that you do?
No, no, no,
Oh,
because it's two different separated things, right? One's for the board, and
mm-hmm.
one is just, hey, I want to be the best either provider or student, but it's not specific for the board.
Okay.
If that kind of content would come in the board, that we would have a 99% failure rate because it's too in depth.
Mm,
It's stuff that like, oh man, we're talking about Respiradol, wall receptor and Respiradol.
mm-hmm.
How is it the D2 antagonistic? Why does it, I mean, it can be a bit complex,
Mm-hmm.
but I broke it down in reasonable manners. That's not as challenging.
Okay.
Now, yeah, that's an option, but it's how you feel about it, really. If you feel like, hey, you want to prepare for the board now, once you enrolled, I'll extend for a year your package. It's not a problem.
Oh, okay. Well, yeah,
Yeah,
I can do
I,
that.
I yeah, like
I major help.
I don't stop. Yeah, I don't stop people from achieving the best results. I work with everybody under in circumstance.
Okay.
Not here entirely for money either. So I have my job. I have my other things. This is
Mm-hmm.
something that I absolutely love. I like it to do. I like to help a lot of people. Um, it's something that I really like. So
Mm-hmm.
no worries. So whatever you need, we'll work something out.
Okay. If
So,
I like, so for me, since I'm 9 months out, I saw like you had, for an example, psychotherapy. Since I'm taking that class, I start next week. Could I skip to that one, or should I
yes,
go?
you,
Over?
you could absolutely, but to be clear, I think your school will give you a lot of fluff. This is
Yeah.
like high yield content for the board. You
Mm-hmm.
could,
Mm-hmm.
but I'm not entirely sure. I think your school will be so fluffy and all
Mm-hmm.
over the place that I'm not entirely sure if the program will be very helpful to you because
Right.
I'm going to be laser focused on board content. But
Okay.
yes, you could. So you can skip around. You can go modules 1, 2, 3, 4, and 5. You can skip around. You can go in order. You can go backwards, however you like. It's unrestricted. You can watch it at home. You don't have to come to the lives, or you can attend all the live classes unlimited. There is no limitations of what you can and cannot do. As much as you want, we
Okay.
want you to pass the board. So
Is it a schedule that is doable? Because you said live, so we work.
yeah, yeah. So it's every Friday at 5 p.m.
Mm-hmm.
Other than holidays weekend, like next week it'll be a
Okay.
holiday, so we won't have it, and we do have a schedule. So yeah,
Okay. Do we jump, since we're new here? We missed like last week. Are we jumping in, or are you going to start us off at a different date?
no, you just jump in because module 1 is really a scientific foundations, but it doesn't stop in you from starting on module 5 and then catching all the way back and doing it again and again and again until you completely can give the class and be like, I'm ready, I'm done.
Oh,
Let's do
okay.
this.
Okay.
So there is no, you can jump in it anytime you want.
Okay.
Because
So
it is not like, it's not a pre-requirement to know scientific foundations before,
Mhm.
you know. So yep, you can jump anytime.
All right. So if I jumped in at, I don't know what's next, but I can go back to whatever you did with everybody else.
Yep.
Okay.
All previous live recording is recorded and available. All previous studio recording, it's there for you.
Okay.
All live recordings is, I mean, live content is available twice a week. Jump in anytime you want. Obviously, Kahoot is free, but the class is it's only part of the people that are enrolled in a course. So
Oh, okay.
so
Okay.
for Kahoot, anyone can come. It's part of the free community. Now, if you want to join the course, then it's more dedicated to you.
Got you. And you teach, because I don't know everything that's on the test. You tell us the breakdown of it as well. You tell us, like, I forgot Kaplan. You know, we remembered that before, but I forgot the rules of how to answer a question. You go into how to answer, the questions, the tricks, all that.
Yeah, yeah,
Okay.
we do. That's part of our the crash course review. The first module is a strategy, right? Like when you're facing this question, you don't know exactly where to go. I would highly suggest you pick this, even if you don't know how to answer the question.
Gotcha.
I mean, we're talking about probabilities here, right? So the best is always knowledge.
Mm-hmm.
And if you come across a question that you don't know, let's apply some test taking strategy. And it becomes second nature. Yeah.
Okay. Okay.
So, so you can either, well, I'm gonna put the link here for you. You can join right away, and then immediately get a link where you can tomorrow start watching or today.
Mm-hmm.
Uh, and since you are early and everybody else, I'm gonna give you a coupon here as well. So that way you get a little break.
Oh, wait, you're breaking up. What did you say? You're gonna give what now?
Yeah, it's like I'm gonna give you $150 off uh of our course for you, and then you can just sign up and
Oh, okay.
get ready. Yeah.
How much is the
Hey guys,
course?
it's $4.99. It's everything together, but then you take it 150 will be so it'll be at 350, 349. So for 6 months of everything together. No, the only thing that's not part of the course is the cycle farm and the flash card. Because the flash card is I rent a place at an app called Brainscape.
Okay.
But this is way more affordable than anybody else as far as because everybody else will sell you this course into 5 courses.
Mm,
And they'll yeah, they'll charge you everything separate, right? So I'm putting everything together in a lot more reasonable price and almost can guarantee you, as the students would tell you there, full support, right? So you're getting helping you all the way. And um yeah, we have a very strong passing rate as
okay.
well.
Do you
So
offer payment plans? Because I'm still paying for
sure.
pre-orders.
Yep, no problem. We'll work with everybody no matter what. Okay. So
Okay.
just just do me a favor then there is a payment plan I believe in the course.
Okay.
Um so let me give you that to you. I think it's through PayPal. Let me put the link here. And if you use the code now, you can get this discount. Now, this discount is not available on my regular website. Okay, so my regular website there is no discount. This is only for you guys that attended today and want to take advantage of this, nice discount. There's a payment plan there.
So,
Uh,
doctor, I have a question. Sorry to
sure,
interrupt you.
no
I'm doing
problem.
my boards. Yeah, I'm doing my boards next month. So
What
what would
date?
be, I'm looking like around about the 19th.
Okay, so check this out. Have you you don't have to answer this if you don't want to, okay? Have
Mhm.
you have you taken the board yet?
No,
You
no,
don't have
no.
to answer. Okay, first
No, no,
time.
I haven't
Okay.
taken it. No, this is my first time. So I'll be
Okay.
taking it, yeah, on the
All
19th
right.
of
So
December. Yeah.
here's the plan for you.
Mm-hmm.
Okay. Very serious planning. you have to score 80% on our diagnostic test. If you score 80%, don't
Mhm.
worry about the thing, you will pass. If
Okay.
you don't, reschedule your test. Why? Because the
Mhm.
first time you take, it will be the biggest opportunity, it will be the easiest.
Mhm.
Our course is laser focused on what you need to know to pass the board.
Right.
If you miss the opportunity, the first opportunity, a lot of our students came from another course because they didn't pass. Okay.
Right.
And they'll pass the second time. But if they miss the second time for whatever reason, the third time will be almost impossible
Mhm.
because the test will change. So what I want you to do is uh reevaluate. So first thing you do when you come to the course is take a diagnostic test.
Okay.
And they will tell you right away today or tomorrow, right? Today is late. Tomorrow where you are. And then
Mhm.
you progress through modules 1 through 5. Module
Mhm.
6 is a crash course review. And then you repeat on module 7 the diagnostic test. And that's going to tell us if you should test the date that you have in less than a month.
Right.
We're pushing the schedule here. Okay. But why is it good for you? Because you can do this 2 hours a day. Being realistic, 2 hours a day, maybe
Mhm.
an hour a day, every single day, because everything is available on the recording portion, and you
Right.
follow up through the groups.
Yeah, I
But
actually put in 4 hours of day study, and so the 2 hours is that's going to be really good. I
yeah,
actually do 4 hours.
yeah. If you and it's more important that and another thing about our courses, let's say module 1, instead of me giving you a 5 hours lecture, I'm gonna give you 23 small lectures of 10 minutes, 20 minutes,
Mhm.
5 minutes sometimes. So why? Because our brain is wired to only remember the beginning and the end. Think about the movie that you watched recently. You're always going to remember the beginning and the end. The
Right.
middle is going to be a blur. So by breaking out 5 hours or 4 hours or 3 hours into 30 small lectures of 10 minutes, 20 minutes, 5 minutes sometimes, you're getting that lecture focus, and then you can go out, watch the dog, do whatever you like, and come back
Mhm.
and be focused again.
Right.
Right? That's called the Pomodoro technique, where you do 20 minutes of intensive work, you get
Mhm.
up, take a break, and come back and be intensive again. Right?
Right.
So that will help you. We have an app. You can watch all the lectures on an app. I don't recommend that, but still, people are traveling. They may want to use their time wisely, right? So we have
Mhm.
an app. So and we have PDFs. So ditch the book. You don't have to read the books anymore. Keep the books only for something that's not very clear on the PDF, and then you are on your way to success. When it comes a week before the test,
Mhm.
you take the diagnostic test number 2. If you score
Okay.
80%,
Mhm.
take the test. Do not reschedule. If you don't, please reschedule, because it's more important that we do this well than do this in a hurry and not achieve the results. Right.
Right. Right.
So I think that's a solid plan, because if you say, hey, I know exactly if I score 80, I'm good. If I don't, then I know now is not the time. I have to put a little bit more time. And it may be the time now. If you score an
Yeah.
80 right away, like in our
Mhm.
pre-diagnostic, I think you should be testing very, very soon. You know?
Yeah. So how do I go about doing the the diagnostic testing and that?
Yeah. So you can have few choices. You can get the diagnostic test alone, or you
Mhm.
can join the big course, which has everything. Honestly, I would join the 30 days PMHNP walk to success. Why would I put my best life in jeopardy over a few dollars? I mean, it's not expensive, right? What I mean is, like, your best life is about to happen. You need this license. Go
Mhm.
full blown in. Go with intensity. Go with purpose.
Mhm.
Now,
Yeah.
if you just wanted the diagnostic test, it's possible too. But the diagnostic test 1 and 2 is part of the bigger course as well.
Right.
Instead of I had like someone bought it by like 5 different small courses, and that cost them more money. And then it's like, hey, let me cancel your order. Let me give you the same thing that you buy into a smaller course that's gonna cost you less. Okay, because it's not entirely about money for me. So I just don't like to see people buying extra when they don't need it.
Right.
So if you like just a diagnostic test, 1 or 2 is possible. If you want to
Mhm.
just a crash course review, it's possible. If you want to just the domains 1 through 5, it's possible. If you want to just the question bank, it's possible. If you want uh all that's separated, is all possible.
So what
It's just
about the
not as smart.
diagnostic? Yeah, the diagnostic test and the question bank.
It is possible to get that separated.
Mm-hmm.
Very
Okay.
possible. They it can be that way, right? And
Mm-hmm.
it's okay too. If you feel that you already been studying and you don't need the extra support with the videos and PDF, you can go just the question bank and diagnostic test. I would not do that though.
Okay.
Honestly,
So what would no, but what would you recommend? Because
I
literally
would look.
it's three
I
weeks,
would recommend it the 30 days PMHNP work success. You got time,
30
and
days. Okay.
y- it's actually 30 days, but it's available for 6 months. Let's say that at the end of the next 20 days, you found out, hey, I'm not ready. You can
Mm-hmm.
continue to study with us for a month, a 2, a 3, however you like. There is no charge. It's all unlimited.
Right.
It might cost me. It might cost you like $1 an hour of my work at the end of depending how long you stay. Right.
Mm-hmm.
So it's stay with us until you are 100% ready.
Okay.
So I would say, and then right now I have this discount there. There is the link that I put in on the chat code, $150 off. So that's pretty nice. Okay.
Okay.
And then immediately today you logged in, you get a magic link. Your magic link allows you to get in a course. Tomorrow, take the diagnostic test. It's going to set the standard where you are today,
Okay.
right? And then your course begins.
Okay.
Everything is one step after the other.
Okay.
All right. Did I
Okay.
answer your question or
Yes,
anything
you
else
did.
that I can help you?
Yes,
Okay.
yes, you did indeed. Yes. So I'll
Any,
just follow this link that you just sent here, and then
yeah,
I can
yeah,
join there. Okay.
yeah. Remember, my website is www.mpexamcoach.com. The discount is not available there, right? It's only on this link, only for you guys that are here today.
I lost the
So
link. Can you send it again?
yeah, it's in a the chat box. Can you open the chat box?
I don't know how to go. How do I go to it?
Okay. So to go in the chat box, you go 1 second. You go, there is the right lower quadrant of your screen. There is a lock in there. And then next to the lock, there is this triangle, and next to triangle there is the message place.
In
You see
call messages.
all the way to the right, all the way to the right lower corner,
Mm-hmm.
right?
I see
There
3
is
dots.
this then go all the way to the right though. All the way. If you go all the way to the right, then you're gonna see like a lock, and then you're going to see after the lock a
Oh,
triangles and some symbol,
I'm
and next to
I'm
that
on my
there is
I'm on my phone.
oh okay.
But wait, I think can somebody send it? It came across my screen.
Yeah, I think I hold on a second.
I
I'm
saw it. I
going.
saw a link pop up.
Yeah, I'm gonna send it again. A link.
Um.
Here you go. I send it again.
Okay, I see. Gotcha.
Use the code now, and
Uh-huh.
then you enrolled automatically, and you get this nice discount as well.
Okay. It'll let me pick a payment plan once I put my information in.
Yeah, I believe so. And if it doesn't, send me an email, PMHNP at NP
Oh, hold on.
exam.
Hold on,
Okay.
hold on, hold on. Okay, I got the PMHNP at what now?
At npexamcoach.com. That's my email. And then we can work something out, find a solution that works for you. No problem.
Okay, and I had one more question. So I'm gonna try
Sure.
to sign up today. So for me, it's 6 months, and then for
Yep.
me, I'm gonna extend. When I extend, how does that help me? Are you gonna add more questions in?
I mean, I'm always innovating the course. Like right now, I'm doing extra, uh, yeah, like changing the questions. I'm always innovating. So, but how
Okay.
that's gonna help you? It boils down to one thing. Right now, you have 9 months away. You're gonna need a little bit more time, and I'm not gonna charge you for it. So
Okay.
you
Thank
basically
you.
gonna get this for as long as you need to pass the board. How about that? You just
Thank you.
hey, you told me that you're gonna extend my course and not charge me. It's like, yeah, I'll remember. I'll go ahead honor what I said I would. So
Okay. Thank you.
absolutely. Uh Lordini, I don't know if you have your hand
Okay,
raised or
Dr. Lopez.
hi.
How are you?
Great. And yourself?
Good. Well, we thank you for always working extra behind to help us. We appreciate that. But
Thank you.
with so much information you're giving us, we wish we can put them in our head. It's a lot. So I have a question though.
Yes.
I was planning. Remember, initially when I initiated the course, I was telling you about. I was planning to take the test, and then you
Yes.
were telling me I need a little bit more time,
Yes.
and maybe thinking, hey, go in your room, please. I'm on the phone. And I'm in December. You were aiming like December,
Mm-hmm.
so I told in the online where I was asking questions about. I did my pre-test,
Yes.
and I did like 60.8, something like that. But
Yes.
when I read over, I see where I did, things that mistake, and I see
Yes.
things that was, you telling us that we could
Yes.
put in consideration. But
Yes.
I'm planning to take my I have two options because I have to reschedule, but like you said, to try the diagnostic aid, I was
Yes.
planning to do that, and then based on that result, I was seeing if I can move the test because I'm supposed to go take it on the 26th. It's like around the corner, and I think they usually say you have 2 days, two
Yes.
days to make the switch.
Yes. So you can jump straight if you go to the all trainings
Mm-hmm.
upper
Yeah, I
left
can see
corner.
it. Mm-hmm.
So go take your diagnostic eight. Let's say you didn't do well, and honestly, if I were you, I would not stress over this. I would just reschedule the test. That's your big day. You don't want anything in between you and your big day. But if you still want to, go ahead, take diagnostic 8. If you score less than 75, I would not take the test. I
Okay.
would not. Okay, I'm gonna even lower from 80 to 75 because it sounds like you really want to take it.
Yes, I
I
do, but I want to go and test and check myself out. If I
Yeah,
do, I'm not gonna take a chance because I know it's a lot
exactly,
of information. And um,
exactly.
one
You
thing
know,
too.
sometimes it's better to wait 30 days and achieve the results because once you take the board and you don't pass, it's
Mm-hmm,
anxiety provoking. It's like, oh my God, do I belong to this? Sure, what am I doing? It
mm-hmm.
can be very difficult. So we don't want to go through that.
All right. Thank you so much. I
Yeah,
appreciate you. Yes.
anytime. Thanks for asking the question.
All right.
Okay. Okay, guys. Anything else I can do for you or help you out in any specifically way? Emma, do you have any Emma Grace? Do you have a question there?
Yes, I'm hi. Good evening, everyone, and good evening, Dr. Lopez.
Hello there.
Yeah, and thank you for reaching out. I really appreciate it because life was lifing for me.
I haven't been like, very active in the classroom, and thank you for checking on me on that. That I really appreciate that.
Yeah.
And lately I have been trying like, to join like, on Friday and Saturday. I'm
Yeah.
like in and out, in and out. But
Yeah.
I feel like, now I'm getting addicted to it, even though I'm
Good.
participating
Good.
much. But if I don't like a Friday, I don't attend, or a Saturday, I feel like very uncomfortable, like I'm
Mm-hmm.
missing out on something. So
Yeah.
I figured out like, life will never stop life, and I just have to make a decision. Since I did take the test before, I
Yeah.
scheduled for the ANCC to take it, but I'm gonna reschedule. As a matter of fact, I'm scheduled for both the ANP and the
Uh-huh. Yes.
ANCC. I really want to take that test before next year.
Yes.
So I will ask you, what are you suggesting that I do in that
Okay.
4 weeks before next year?
4 weeks.
I want to take the
So
test. What are you suggesting that I'm doing?
yes. So it can totally be done in 4 weeks, right? So what I would do, I would wake up early. I would wake up early before your day because I tell my daughters, eat the frog early in the day. And she's like, "You crazy, Dad?" It's like, "Yeah, I am." But check this out. If you do the thing that you don't want to do the first thing in the morning, your rest of your day is gonna be beautiful because the most difficult thing has been done. Starting at the end of the day is a horrible idea because you're tired, you are hungry, something has happened in your day is making you upset. So kill the what's most important to you right now is your job, your family, but right now is passing this test. So kill it first thing in the morning. Wake up early, get 2 hours in, follow the PDFs, finish the PDF, do the question bank, follow the next PDF, finish the PDF and the video, question bank. Then arrive to module 7, diagnosis test 1, finish that. And then you should know where you are really good in 4 weeks. It is very possible. We had people coming in 3 weeks and done it, everything. 3 weeks, complete board preparation. Yeah.
I'm not sure if I do it like, something wrong with the question back. Most of the time, I just took like, the way you've been explaining it, let's do like, block one. Since how you are explaining it today, I never understood it that way before. To do the
Mhm.
comprehensive test, I haven't been like, doing them.
hmm Yeah, the comprehensive is very good for the AANC, right? ANCC, I'm sorry. So very good. The broad question bank is very good for the other test because it's going to be very broad.
And I
Okay.
did take, the first diagnosis test. I think I score, 68 or 70. I didn't look like,
So you,
I didn't
yeah,
look at the answer or anything like that. I was trying like to do the two after I finish all the module. Is that
yes,
the way I should do it, or
yeah, absolutely. Only take test 2 when there's like you feel that is your board is a week away and you got everything that you needed. At
okay?
least you have gone through everything. Yeah.
All right.
And most important, if you're not scoring 75 or above, 80 or above, don't test it.
Okay.
Because if you already tested once without us, right? Your second test, it's almost your last chance. We do not want to screw that up.
Okay.
We do not. Even if, oh, I don't want to take before this year, I get it, I understand it, and I agree. But once we go test, we're going to pass. We are going to pass. There is no doubt. There should be no doubt. So let's not rush perfection for an extra month. It would be nice to be done now, but we are not going to jeopardize your future,
Yes.
especially since this is your second time
Yes.
testing.
I
Okay,
keep
so
like,
we definitely
switching the
now,
date, paying the
yeah,
$49, the $100, keep switching the date. So I'm just
yeah,
gonna put the time on myself. I'm just gonna switch it like for the last time and then commit it to it. Like
that's it.
morning
Yeah,
and night, that's committed to it, no matter how life come, because I figured out it's not gonna stop coming.
it's not going to stop coming,
Yeah.
and there is never a good time. It's always something. So
Oh,
go at it, go with intensity. I you know, I'm concerned because you already tested once without us. So I want you to see you pass the board. So, you know, if you're not coming the door, busting the door open, like, come give my certificate, then you shouldn't test.
Yes.
Because, you know, as we walk in that door, there is only one way out is being certified. Okay. Only
Alright.
one way out.
All right.
Okay.
Thank you
Cool.
so
Thanks.
much. I appreciate it.
My pleasure. My pleasure. Anybody else? Olu, do you have a question there? Or anybody else, really?
I had one more.
Oh, yes, please, Mikaela.
I'm trying to pay for it,
Right.
and the only option I see is full pay. It doesn't give me a payment plan.
Oh, okay. Let me check it out because I haven't been there in a while. So, Michaela, do me a favor, email me, please,
Okay.
and then I'll work something out because I may not have it set up on this website for payment plan. Okay.
Okay.
Just
Okay.
yeah, because I don't think it. I have something set up here. Yeah. Just go. Okay. Alrighty then. Anybody else? Anything else I can do for you guys today or help you out in any other way at all?
Dr. Lopez, I have one question.
Please go ahead.
I just wanted to know with your diagnostic competency test or readiness, is it just a one and done for both of those?
No.
Just to test where we're at? Okay.
So it's 2 diagnostic tests. One is a repeat. So you're gonna take it 3 times. Right.
Okay.
So first one you come in, take it. And then forget it. Don't look at the answer. Then you do the modules, and then we're going to repeat to assess what you learned. And you should see improvement. And before you take the diagnostic test 2, there will be a validation for your board date. Okay. So yeah. Hopefully that answered your question.
Yep. So the first initial one will take another time before we take the last one before our test, our actual test.
Yep.
Okay.
Exactly. So there is a pre, there is a module 7 and module 8 diagnostic test.
Okay. So pre-module 7 and then module 8.
Yep.
Got it. Thank you.
Absolutely. Anybody else? Anything else I can help you with, guys?
I have a question.
Hello there. Yes,
Hello.
please.
Yeah, I've been listening. The pharmacology course, how long do you have an access to it after you
1
take
year.
it? 1
1
year?
year.
Oh, okay.
Yep.
And
1 year.
I'm also interested in the payment plan.
Yes.
So,
Email
so should
me.
I send an email too? Okay, all right.
Yeah, email me so that way I can work something out, you guys. I don't have a payment plan, but like I said,
Okay.
you know, guys, I get it. I get it that you have school loans, and I get it that
Mhm.
things are hard sometimes. I'll work with you guys. Come attend our
Okay.
classes 6 months as long as you need on the chill pass. I'll work with everyone. Yeah, I have some employees that I have to pay. Sometimes I have to pay out of pocket, but has never been a people have been kind to me in the past. That's what I live for as well. So email me. Okay.
Thank you so much. Thank you.
Yeah,
I just
absolutely.
sent you an email.
Okay. Yeah. Gonna probably eat something and you get a response in a little bit. Okay.
Okay. Thank you.
Thank you. All right, guys. So if nothing else, study hard. Go get your best life. Let nothing stopping you from being wonderful and getting what you want out of life. Okay. All right. Good night, everyone.
Thank you.
Thank you. Bye bye.
Thank you.
Thank you. Bye bye.